Hello everyone, I am Dr. Aarushi Mittal. I am a dermatologist, cosmetologist and trichologist from Guwahati, and today we are going to understand male pattern hair loss and how we can help you deal with it. Male pattern hair loss basically is a problem that almost 30 to 50% Indian males suffer from. It is a problem that involves hair loss mainly from the top of your head and from the sides of the front part. Male pattern hair loss, in my opinion, is a multifactorial condition. That is, a lot of reasons pool up together to cause the problem, but mainly it is genetics and hormones. Yeah, there are multiple lifestyle factors that contribute to it. As we've already talked about, there is mainly genetics and hormones, but the other things that influence it include stress, smoking, diet. If you're taking some medicines, that could also impact it. If you're having any other chronic illness, that could also aggravate the problem. So basically, the treatment for male pattern hair loss, I like to divide them under three headings. The first treatment, or the very basic one, is to go for medicines. These include mainly minoxidil, finasteride, dutasteride. There are various growth factors. There are various serums that include those growth factors like Procapil, Redensil, Capexil. Other than the medicines, you could go for some procedures. Under the procedures, we have PRP, GFC. If you want your head to look fuller, you could also go for microblading and stuff like that. But the last resort, the last and final resort, which is also the most effective one, is hair transplant. But personally, if you ask me, all the three things have to be taken together for you to get maximum effect out of any of these. So minoxidil was a medicine which was initially formulated for hypertension. We saw that it dilates blood vessels, and one of its side effects was that it was causing increased hair growth. That is when we started using it topically over the scalp, and we also started taking tablets, and we realized that it causes increase in blood flow over the scalp area, which leads to better hair growth. So you cannot reverse male pattern hair loss in totality. I'll explain this with an example. As we grow old, the volume of hair on our scalp decreases. For example, if you were 10, probably had 1000 hair follicles per centimeter square in your head. By the time you're 50, you might only have 30 to 40% of that volume remaining on your scalp. But if you're somebody who has male pattern hair loss, the volume would be around 20 to 30% of what you had as a kid. Now, if you've been taking medicines, the volume would be much more than what it would have been without the medicines, but it still might not be at par with other people of your age. So you can slow down the process, but you cannot completely reverse it. I think early intervention is the best thing that you can do when it comes to managing male pattern hair loss, because as the disease progresses, what happens is initially your hair follicles shrink in size. So the follicles are still there, but they are not visible to your naked eye. Let's say you're 25 at that age, so if you give medicines, the follicles will regrow. But once the follicles have fallen off, no amount of medicines will work, and you will have to go for a hair transplant. Thank you for watching Dermis with Dermats. We'll be back with another interesting episode on skincare and hair care soon. If you have any queries about male pattern hair loss, drop them in the comment section below.